Good afternoon, everyone, and welcome to our weekly COVID-19 press briefing. And again, the city manager is going to go over the city numbers, but they're going in the right direction. Our weekly numbers are going down for infections, but again, as we say, wear your mask, practice good social distancing and good hygiene, continue it, and we're going to win the battle together as a city. So keep in there and hang in there. And I know it's been a long, almost year now since we had our first press conference, but I think that working together we'll get through this. Nationwide numbers, nationwide we've seen an increase of over 100,000 cases nationwide to over 27.5 million cases. Statewide, we've seen almost 550,000 positive COVID-19 cases. Yesterday's new tally was 1,369. The last time we had these daily increases that low was back in November. So November 30th to be exact. So right now we're in a bit of a plateau as far as our numbers are concerned, which is a good thing. And again, still practice wearing your mask and don't take it for granted. We have a long ways to go here. We're working through the testing of vaccines and basic hygiene practice to collectively break this back of the virus. And again, this is going to take us some time. The vaccine program will grow over time, just as our testing program did. Please continue to practice wearing your mask and be patient as more and more vaccines become available and more sites come online. And as I said last week, we know it's frustrating going through the process here, so be patient. We will work the bugs out as a state and get it right. And the vaccines are also going to be based on availability too. So as the government gets the vaccines and pushes them to us, we will distribute as many, 100% of what we get going forward. So again, it's going to be based on availability, so things could change week to week and day to day on the vaccines coming here into the city of Worcester. Nearly almost 1 million people have been vaccinated with their first shot of the vaccine as of today. We have seen the curve bend as the new infections decrease and vaccinations are spreading. This delay continues as the weather improves. And I know it's hard to imagine, but we're already halfway through February. We're going to see the better weather come around the corner pretty soon. So if you can be vaccinated, please be vaccinated when it's your turn. Do not ignore that. We're asking everybody to be vaccinated when it's your turn. New vaccination info. Since we spoke last week, 211 has now begun accepting calls. It's being used to schedule a vaccination appointment. The state DPH is still instructing those who can to use the website if possible. That's mass.gov/COVID-19-vaccine. So you can dial 211 if you're not set up with internet service. The state announced also that DPH announced that people over 75 can make vaccine appointments for themselves and a younger companion. And these apply only to new appointments and only at the MassVax sites. So you can bring a companion and register that person at the MassVax sites and for new appointments. And as more sites come on, Natick Mall in Natick, Circuit City site in Dartmouth are opening Thursday, February 18th. The Reggie Lewis Center in Boston will be open to residents from across the state of Massachusetts. And of course, the Worcester State University opens on Tuesday, February 16th. UMass Memorial has opened their own vaccination site for their own patients at the Mercantile Center that runs during the week from 8 a.m. to 4 p.m. And schools reopening date was voted last week by the school committee. Group C will be returning for in-person learning on March 15th. All other students will have chosen their hybrid model will be returning on March 19th. And as the weather gets better, it will be safer. The city manager and the city council has voted $15 million to invest into our public buildings, which the school buildings have been updated with the ionization process. So our school buildings will be safe when the kids return to school. Just want to mention senior calls. We outreach to the seniors on a weekly basis. We called 952 seniors this week, and meals delivered to 4,919. Again, this asks you to wear your mask, practice good social distancing and good hygiene. Be patient. I know it's frustrating when it comes to the vaccine and people are nervous. So just be patient. It's like we had the testing. It took us a few weeks or a month to get through the testing, work all the bugs out. We will work this out, and this will be running pretty smoothly, hopefully, pretty soon. So thank you. I'd like to turn it over to the city manager.
Thank you, Mr. Mayor. As of today, City of Worcester has had 19,871 confirmed positive cases of the coronavirus in the city since the beginning of the pandemic. This week, we've had an additional 550 cases. That's slightly up from last week's numbers. Last week's number was 492 new cases. This week is 550. So not a huge increase. We don't think that that's a reversal of the trend that we've been seeing. Today, we had 75 new cases, and while this marks an increase over the last 4 weeks, it's a decline since our peak period. So I think the mayor alluded a little bit to this. On January 11th, at our peak during the second wave, our 7-day average was 196 cases a day. As of today, our 7-day average is 78.6 cases a day. So you can see that's significantly below where we were. And again, for context, back in November 13th, we were at 77.57 cases per day. So you can see this is really hopefully back to the range that we were in pre this second surge. For the towns, the town of Shrewsbury had 91 new cases for a total of 2,412. Town of Holden, 39 new cases for a total 1,204. And Grafton, 30 new cases for a total of 941. The combined UMass Memorial St. Vincent numbers, inpatient COVID positive patients, 119. That's down 69 from last week. So that's a nice significant decline in the number of inpatients. ICU patients, 37. That's down 7 from last week. COVID deaths between the two health systems, 20, bringing the total to 642. And COVID positive health care workers, 27, bringing their total of 1,720. City of Worcester specific deaths are 10 additional since last week, bringing the number of total deaths in the City of Worcester residents, 392. There are currently 20 COVID positive patients at the DCU Field Hospital, so we continue to see those numbers come down as well. And likewise, city employees, we have 2 who are out isolating because of positive tests for the coronavirus, and 1 who's in quarantine because of a close exposure. So that's 3 City of Worcester employees. That's one of the lowest numbers we've had for a while, so that's also good news. On Monday, our emergency dispensing site at the senior center started administering the second dose of the COVID vaccine. And we also have started administering doses to seniors 75 and older. A reminder that those appointments can be booked by visiting www.mass.gov. If those appointments are full, folks should continue to look online for appointments at the mega sites and the pharmacies. To date, we've administered a total of 4,567 vaccinations at the Worcester Seniors site. We've done 3,414 first doses and 708 second doses. We've also done 445 mobile distributions of the vaccine. So far, we've done 568 seniors, 328 of those from the City of Worcester. First responders, we've done 340 first doses for Worcester police officers and 234 second doses for Worcester police officers. Worcester firefighters, 311 first doses and 207 second doses. And our emergency communications folks, 37 first doses and now 13 second doses. So next week at the senior center, we'll be administering second doses only. We had a big influx of folks when we first started the clinics who are now becoming eligible for their second dose vaccine. So on Monday, Tuesday, Wednesday, and Friday from 8 a.m. till 6 p.m. Next week, the folks from the first phase who are now eligible for their second phase, second dose, will be coming through the senior center. Dr. Castile, who's been really spearheading our efforts to go mobily to some of our vulnerable populations, will now be next week also going to some of the shelters that she had gone to deliver the first vaccine to begin next week delivering the second vaccine. We expect folks at the Ascension Hotel Grace site for homeless folks to be receiving their second vaccines next week, as well as the Martin Luther King Center off of Chandler Street, the SMOC main shelter on Queen Street, and the YWCA shelter on February 18th. And then February 19th, she'll be at Abby's house administering second doses to folks who are there. As the mayor alluded to, we know there's a lot of frustration about the process, and I do think that each week that goes by, the system does improve. It does bring on more sites and more vaccines and more options for booking an appointment. The 211 system is now up and running, and hopefully that's helping some of the seniors or their caregivers who have had trouble or don't have internet connections to book online appointments. The 211 system will allow folks to do it over the phone. And so that hopefully is helping individuals navigate that process of booking an appointment if you're 75 and above. That system is for only folks 75 or above or their caregivers who are helping someone book an appointment. The Worcester State facility will open this coming Tuesday. They'll operate 5 days a week from 9 a.m. till 5:30 p.m. Tuesday through Saturday, and hopefully, again, depending on the availability of vaccines, we will ramp up. So the more vaccines that we can get to that site, we will do as many injections as there are vaccines available. We expect to probably start off with about 500 next week. We've also learned that there are several private vendors who are providing vaccines here in the city of Worcester. And I want to caution folks that there are not set times, there are not set allotments, so it's going to be a little haphazard, but there are going to be availabilities on an unregular basis. So folks should take a look and continue to check. The Big Y on Mayfield Street here in the city of Worcester, you can go to their website, bigY.com, and check to see about an available appointment. We're also told that the Price Chopper on Pullman Road and the Price Chopper on Cambridge Street also have been intermittently offering vaccines there. You can access the availability at pricechopper.com, and the CVS on Lincoln Street, 481 Lincoln Street. So you can check that availability at cvs.com. So again, our understanding now is it's not a regular amount each day, but intermittently each week, based on their access to vaccines, there may be appointments available at those locations. Our goal right from the beginning has been to do everything that we can to provide the infrastructure to put as many vaccines in people's arms as are provided to us by the Commonwealth. And we have worked with our partners, and we continue to work planning for subsequent phases when there is more availability of the vaccine, to have systems in place to make sure that we get them out. We did a call, Dr. Castile and I, with a lot of the home health organizations that work with our homebound seniors to try to put a plan together that when there are additional vaccines, we can go out and distribute vaccines to the homebound seniors who we know can't get out to some of these sites, and we need to have a different process, a different mechanism to get to them, and that planning and that organizing is now underway. Finally, sharing information. There's a lot of information floating around, and it changes rapidly. The state has launched a new public awareness campaign called Trust the Facts, Get the Vax, aimed at raising awareness about the COVID-19 vaccine. The commercials have started popping up on TV. You can go on the mass.gov website and learn more about that. And we really urge people, we've been doing it through town hall meetings and forums and any vehicle that we have and these press briefings. But if you're somebody who, as a family member, who's maybe skeptical, got a lot of questions about the vaccine, should I take it? Maybe you're part of a church group or a civic organization. You've got neighbors who've been talking to each other about when your time comes to get the vaccine, should I take advantage? There are mechanisms for you to go educate yourself, get your questions answered, and hopefully give yourself and your friends and your family the comfort level that we think many people are looking for, so that you do take advantage when your time comes to get the vaccine. We want everybody who's eligible to take advantage of that. With that, I'll turn it over to Dr. Hirsch.
Thank you, Mr. Manager, and thank you, Mayor Petty. Yeah, I think the overall frustration that we hear about is still an indication that the messaging we've been putting out about the importance of vaccination has reached the people, and the people are clamoring for it. And I think we're getting the bugs worked out slowly to get the distribution better. So, in the, I guess it's not a medical thing only, it's a management thing. When people talk about a SWOT analysis, where you have strengths, weaknesses, opportunities, and threats. For the SWOT analysis of where we are with the pandemic, I think the strengths are that we've really been seeing the numbers go down nationally and regionally. Even though we had a slight bump up this week in Worcester itself, the overall numbers in both the health centers and in both the medical centers have gone down precipitously. And I think as an illustration of how well the vaccination program is going, you heard today the city manager quote only 27 healthcare workers in both systems are suffering from COVID. And we used to report out numbers that were well into the 150 to 200 range. So now we're talking about, about 4 people a day instead of, we used to have 15, 20 people a day getting infected. So those are healthcare workers that have gotten vaccine, and I think it's a very positive sign that when you get the vaccine, you really see the number of cases go down. And that's what I'm looking forward to all of us celebrating, is when we're all feeling that way. So that's one of the strengths. What are the weaknesses? The weaknesses right now are really in situations that are beyond our control. As the city manager said, we want to give as many vaccinations out as we have vaccine. If we could get more vaccine, we would be giving out more of it. We haven't wasted a single dose here in Worcester, and I know there's been a lot of reports about cities and towns around that have had wasted doses. That hasn't been our case. We have some wonderful public health nurses that watch every single dose so meticulously, it would not happen. And we've developed a backup list for our clinics, so that if we do see that we're having an excess of doses towards the end of a long clinic, we have people we can call in, and that's worked out really well. So as far as opportunities go, I think the great thing that we've been seeing is, now that we've trained up so many of the medical students, and the nursing students are there as well to stand shoulder to shoulder with them, we have about 660 trained now. We have another training coming up of about another 40-odd students from UMass system. But all the other institutions are also anteing into this army, the ones that have nursing programs like Becker and Assumption and Anna Maria and Worcester State. And that's giving us tremendous flexibility and boots on the ground. So much so that the Vaccine Corps, as it's called, out of UMass, is being called upon to actually dispatch their students to all different places in the Commonwealth, because UMass is the Commonwealth's medical school. But we've been able to maintain a steady stream of volunteers up at our emergency distribution site at the Worcester Senior Center, and the energy and the vibe of just everyone feeling really great about being able to contribute to beating back this pandemic is still really super. And I can't say enough about the Department of Public Health staff and the emergency management staff for continuing to stand up our program, and every single dose is accounted for, all the second doses now that are coming in, and the satisfaction that we get from seeing the patients go through this really seamlessly, and the reports back that we get from those patients saying that it's been a real easy process for them is really rewarding. The threats that I would say in this SWOT analysis is really twofold. One is the Moderna and COVID vaccines will keep you 95% of the time from getting a severe case of COVID. But we don't know if it can still keep you from being a silent spreader. We still don't have that information yet. I've been watching lots of programs, reading lots of articles. There are some incredibly encouraging articles coming out of Europe that they haven't seen silent spread in the UK spread analysis that they've done both in England and in Israel, where the UK variant has taken root. But we're not 100% sure about that. So that's one of the frustrations I know people have. When they are getting the vaccine, they want to rip their mask off and go back to completely like it was in 2019, and it's just not time yet. And we're just going to have to continue to be vigilant, because you could still, number one, be the 5% that get sick even if you have the vaccination, and you also could be somebody that would spread it to somebody who doesn't have the vaccination. So we'll know, I think, in a few months how likely it is that silent spread is there. But if it's proven not, which I hope it's not, there'll be a time when we can really start backing off on some of the mitigations that people have gotten kind of used to. Again, on the positive side, like I mentioned a few weeks ago, the flu season has been crushed by wearing masks, and with all this social distancing, there's been very little flu around, and that really helped us to avoid the twindemic. So that's really on the community of Worcester. Worcester has really responded, and we didn't get flooded with cases just when we were getting that huge post-Thanksgiving surge. So I take my hat off to the Worcesterians out there that listen to those admonitions that we do every week here at these press conferences. The other threat is the strain stuff. The UK strain seems to have a very, very fast doubling time, and Dr. Fauci predicted that probably by April, which is about when general distribution of the vaccine is going to come, it might be the predominant strain by then. So far, the data coming from both Britain and from Israel show that both the Pfizer and the Moderna vaccine has been very effective against the UK strain. It's just that the UK strain really is very, very transmissible. So before you get that vaccine, you're more susceptible, just because this new variant, the UK variant, does bind into your lungs much more easily. So even a short lapse with your mask off can get you a chance of contracting that if you don't have the vaccination. But if you do, you're probably going to be okay. So that's why we just have to get the vaccines out as fast as we can, and maybe we can beat the upward trend that would come from the UK strain if it really went unchecked. That's the threat that I could also identify. But overall, I think the news is really good, and both hospital systems are thinking about revving up again more normal operations as their numbers of COVID patients come down, and redeploying some of their surgeons who've been redeployed into ICU settings, getting them back in the operating room where they really prefer to be. So that's also a really good sign. So I feel really positive about things. I think that we've done everything as a city, as a Department of Public Health, as a Department of Health and Human Services to try to reach out to our seniors, to the vulnerable populations, to the wonderful first responders who try to keep us all well and are most exposed to COVID patients. And I think the hospitals have stepped up too. UMass has given in the range of about 25,000 vaccinations now. St. Vincent's about 7,000, and between the efforts that we're putting out at the Worcester Senior Center with another approximately 4,000 between the mobile efforts of Dr. Castile and that center, we've gotten a lot of needles in arms in only about 3-4 weeks. So it's really exciting. So the last thing I'll say is, because I won't be seeing you till the day is past, is we are the heart of the Commonwealth. You see it right there, and Valentine's Day is coming up this coming Sunday, and I'm a New York City kid, but I'm always very curious when I see plaques on the wall and names on doors like, who are these people that we're honoring? And I've been walking in and out of the Esther Howland room so many times now in my kind of newer role where I hang around City Hall every once in a while. I never really knew who Esther Howland was, but she is widely responsible for Valentine's Day being a thing. In 1847, she graduated from Holyoke College, Mount Holyoke College, and as a congratulatory thing, she got a Valentine's Day card from England, and those things were not very commonly exchanged here in the United States. She got the idea that she could produce nicer ones here in Worcester, so she started the New England Valentine's Day card company, which worked right here out of Worcester, and made Valentine's Day card exchange a thing. Just like everything else that I've experienced in my almost 36 years here in Worcester, Worcester is a lot about love, and I'm really happy to know that we make Valentine's Day a thing, we make the smiley face a thing, and I think we're beating the pandemic back because of all the good vibes that we have between the city and our community and our medical partners. So I wish you all a happy Valentine's Day, and thank you, Esther Howland, for figuring that out. And I remind myself I got to get a Valentine's Day card. So, thanks.
Just a couple questions for Dr. Hirsch. In terms of the numbers, do we know what the positivity rate is for the positive tests?
So our positivity rate as Worcester goes has come down to less than 20% for the first time in a long time. We're at 18.9% now, according to the Mass Department of Public Health. So that's the number of people that were tested in the last 2 weeks. It's come down to that level. It's still high. I mean, we'd like it to be, less than 10% for sure, but it's definitely on a trend down.
And then just one more question. With people getting the second doses, have we seen a percentage of how many people are actually coming and getting that second dose?
Well, I can't give you an exact percentage, but it's very, very high. We haven't really had more than, I would say, 4 or 5 missed appointments this week, where we've only been doing first responders getting second. And most of them, when we've called them, have had like an explanatory thing. They had to work a shift, an odd thing. But no, it's been very, very high compliance.
And then just one question for the city manager. A quick follow-up. I know you said next week the super site will be 500 vaccines. Is that per day? Is that per week? What do you kind of estimate the kickoff?
Per day.
Okay, that's what I thought.
Yep.